Okay. All right, so today we are going to be talking about heart health. My name is Kayla Rogers, and I am an Education and Outreach Coordinator for the Women's Fund. This presentation is really important. There's a lot of valuable information in this presentation. I do want to go ahead and say that we're not going to be able to go as in depth as I would like, just because this topic we could talk about for multiple presentations. But I just wanted to give a good starting point and provide some information that hopefully you will find extremely valuable. Before we dive into the presentation, I just want to give a little bit of background about the Women's Fund for those who are not familiar with our organization. We are a nonprofit in Houston dedicated to providing women and girls with the tools they need to be advocates for their health. And we do this through focused seminars like today's class, as well as curriculum-based classes and publications. So all of our publications are free. You can download PDF versions from our website. The link is there below, as well as the QR code. Or you can also visit our website to place an order to receive physical copies of our publications. Again, they are all completely free. So this is our agenda for today. These are the things that we're going to be discussing. First off, we're going to start with women and heart disease and just kind of briefly touch on that. We're going to be talking about types of heart disease, signs of a heart attack and stroke, different treatment options for heart diseases, modifiable risk factors, and things that we can do to prevent or help try to prevent heart disease. And then we'll have a review and closing. And as mentioned earlier, I am going to be doing the raffle drawing today as well. So at the bottom of the screen, you see this little text bubble. Anytime you see that during the presentation, that means that I'm looking for you to participate, and you can do that in the chat. So please utilize the chat button when you see that little image pop up on the slide. By the end of this session, I hope that you're able to identify signs of heart attack and stroke, state risk factors for heart disease, and also list 3 preventative measures for heart disease. So 3 things that you can do to help prevent heart disease. Alrighty, let's get started. So I wanted to start off with a little bit of vocabulary, just because the 3 terms on this slide you may hear often. So we have cardiovascular disease, heart disease, and coronary artery disease, which is abbreviated as CAD. These terms are often used interchangeably. However, they shouldn't be, because they are in fact different. So cardiovascular disease is the umbrella term, as I call it. It is a term for all types of diseases that affect the heart or blood vessels. So that's why in this previous image with the triangle, it was the biggest part of the triangle at the very top, because it is the broadest term. Under that, we have heart disease, and this refers to a variety of conditions that affect the heart's structure and function. So this is kind of like a catch-all phrase for all of the diseases that are going to affect the heart. And heart disease is a type of cardiovascular disease, falls under cardiovascular disease. And then finally, we have coronary artery disease, which is also commonly referred to as coronary heart disease. And this is a type of heart disease. So although these words are used interchangeably sometimes, they are different. Okay. So we are going to be focusing on heart disease today. And we're going to start off with just kind of a brief intro to heart disease in women. So there's this kind of misconception or this thought that heart disease affects men more than women, and that's just not true. Heart disease is just as dangerous for women as it is for men, and in fact, almost as many women die each year of heart disease in the US as men. So it is the leading cause of death for women in the United States, with 21.8%, or 1 in every 5 deaths in 2017 for women. 1 in 5. That is a lot, right? So if you are interested in learning more about the leading cause of death or heart disease in women, I've provided some QR codes here for you. As I mentioned, it is the leading cause of death for women in the United States. When you break it down by race and ethnicity, it is still the leading cause for Black, White, American Indian, and Alaska Native women in the United States. And it comes second behind cancer for Hispanic, Asian, and Pacific Islander women in the United States. But in total, overall, it is the leading cause of death for women. So it's a very important topic for us. So there are many different types of heart disease, but today we are only going to focus on these 4. So we're going to talk about coronary artery disease, heart failure, arrhythmia, and cardiomyopathy. So coronary artery disease is the most common type of heart disease in the United States and is caused by atherosclerosis, which is what we're going to dive into on the next slide. The most common symptom is angina or chest pain, and there are 2 types of angina. You have stable angina that happens during physical activity or if you're under mental or emotional stress, and then unstable angina, which occurs when you're at rest or without any apparent reason. And that unstable angina is considered a medical emergency. Okay? So over time, coronary artery disease can weaken the heart muscle and may lead to other heart conditions or problems, including heart attack, heart failure, and arrhythmia. So as I said, atherosclerosis causes coronary artery disease, but you may be asking, what is atherosclerosis? Well, other than being a kind of difficult word to pronounce, it is a fatty plaque buildup in the arteries that supply the blood to the heart, so in the coronary arteries. And this gradual clogging or building up of this plaque narrows your artery and reduces blood flow and oxygen. So this process is the underlying process in most heart attacks and strokes. So the most common type of heart attack is caused by a blocked artery in the heart by atherosclerosis, and the most common type of stroke is caused by the blockage in the neck or brain. So this is a very a dangerous process. So as I mentioned, the heart attack is caused by that blockage in the heart. Heart attack is medically termed as myocardial infarction, or MI. And what happens is that fatty plaque buildup, or the atherosclerosis, causes your arteries to narrow, and this leads to ischemia, which is the lack of blood and oxygen flow to the heart. So once that happens, your heart muscle is essentially starved for oxygen and nutrients, and this leads to damage or death of part of the heart muscle, and this is a heart attack. So signs and symptoms of a heart attack can develop suddenly, but they can also develop slowly and over a time period. These are some of the common signs and symptoms. So we have an uncomfortable pain in the center of your chest. It can be described as a pressure, a squeezing, a fullness, but lasting more than 2 minutes. A pain in one arm or both arms, in the back, neck, or jaw. Shortness of breath that can occur with or without chest pain. Breaking out into a cold sweat, feeling nauseous, lightheaded, dizzy, or fatigued. So women are more likely to have symptoms of shortness of breath, feeling nauseous, vomiting, having some fatigue, and then pain in the back, shoulders, and jaw. So just because you don't have chest pain doesn't mean that you haven't had a heart attack or you're not experiencing a heart attack. If you think that you've had a heart attack, do not ignore it. Okay? Call for 911 or help, even if you're not sure. And the reason for this is that acting fast can save your life. An ambulance is going to be the best and safest way for you to get to the hospital. Because once you're in that ambulance, the EMS can provide you with life-saving medications and really get treatments started right away. And oftentimes people who arrive to the hospital via ambulance are seen quicker. Also, calling for 911, the dispatcher may be able to give you some advice as to what to do. And so you want to make sure that you act fast. Even if you're unsure, it's better to be safe than sorry because every minute matters. So the second thing that we talked about with the atherosclerosis was the potential for stroke. And cerebrovascular accident is a medical term for having a stroke, and it occurs when that blood oxygen supply to the brain is interrupted by a thrombus, an embolus, or an aneurysm. So a thrombus is going to be a clot in a blood vessel. An embolus is going to be a clot that is floating in the bloodstream, and an aneurysm is going to be a weakening in a blood vessel that's going to cause it to burst or hemorrhage. And so when you hear stroke, you hear, oh, it was just a stroke or major stroke or mini stroke. So this would be just a stroke. Maybe some people refer to it as like a major stroke. The mini stroke, on the other hand, is the transient ischemia attack, oftentimes just abbreviated as TIA. And this is going to be a brief interruption of blood supply to the brain. So there's only going to be some temporary impairment. An interesting thing is that 1 in 10 major strokes are preceded by this TIA or this mini stroke. So I thought that it was important to kind of list some of the unique risk factors to women when it comes to stroke, because stroke is the 4th leading cause of death among American women, and 1 in 5 women will have a stroke in their lifetime. And so we do have some unique factors that can play into this, including high blood pressure during pregnancy, certain types of birth control medications, especially if you're a smoker, and having higher rates of depression and anxiety. So these are all things that can contribute or put us at a higher risk for having a stroke. So we know what a stroke is. We know some of the unique risk factors, but how can we identify if we're having a stroke? Okay. So some of the warning signs of a stroke include sudden one-sided weakness or numbness in the face, arm, or leg. So typically people who have strokes will present with numbness on the right side of their body or the left side of their body. It's usually one-sided. Sudden dimness or loss of vision, again, particularly in one eye. Loss of speech, trouble talking, or difficulty understanding speech. So if they seem kind of confused or they're unable to get out a clear sentence that doesn't sound slurred. Sudden severe headaches with no known causes, and then unexplained dizziness, unsteadiness, or sudden falls. So these would be some of the signs. Now there is an acronym that is commonly used when discussing stroke, and I want to know if any of you know what that acronym is. So if you have a guess, go ahead and place it in the chat. So are any of you familiar with an acronym that is used commonly when discussing stroke and the symptoms of stroke? Give just a few more seconds. No? Okay. FAST. Yes. Okay, so it is, in fact, fast. So I found this cute little graphic, but if stroke happens, act fast. So the F is going to stand for facial drooping. You can ask the person to smile and see if one side of the face is drooping. Again, you'll notice that symptoms appear to be on one side as far as weakness goes. The A is arm weakness, so you can have the person raise both of their arms up, and if you notice that one arm is involuntarily drifting downward, that can be a sign. S is for speech difficulty, so you can ask the person to repeat a simple sentence, and you want to assess if their words are slurred or if they're having trouble even speaking. And then T is time to call 911. So if the person shows any of these signs or the signs that we discussed earlier, you definitely want to call 911 and get the person some help. Okay. So what to do? Again, if the symptoms last more than 5 minutes, call 911. Do not drive yourself to the emergency room. We talked about this with the heart attack, but the ambulance is really the best and safest way to go. And contact your doctor even if symptoms do not last more than 5 minutes. So just because your symptoms are, maybe say you experience them for 3 minutes, that's still 3 minutes, right? And if you remember, 1 in 10 major strokes are preceded by TIAs, so that brief interruption. So just because your symptoms don't last a long time doesn't mean that you shouldn't take them seriously. So the second type of heart disease we're going to discuss is heart failure. And with heart failure, the heart cannot keep up with its workload, and it's not pumping blood as well as it should. Therefore, your body is not getting the needed nutrients and oxygen. And so a common misconception here, it does not mean that your heart stops beating. Your heart is still beating, it's just not working as well as it should. And because of that, it's going to compensate in other ways. So it may do so by enlarging or stretching so that it can contract more strongly in order to keep up with that demand to pump more blood. It may develop more muscle mass in order to help the heart pump more strongly. It may pump faster so that it's increasing its output. Your blood vessels may narrow in order to help keep your blood pressure up and try to make up for your heart's loss of power. Or it may divert blood from less important tissues and organs to the heart and the brain. Okay, so as we age, we're all going to lose some blood pumping ability, but heart failure is going to result from the added stress of health conditions that damage the heart or make it harder to work. These include the coronary artery disease that we talked about, also hypertension, diabetes, obesity, sleep apnea. All of these things, including lifestyle factors that increase your risk for heart disease and stroke, can contribute to heart failure. So some symptoms include fatigue, shortness of breath, coughing, and swelling of your feet, your ankles, your legs, your abdomen, or your neck. So due to the attempts of your heart to compensate, you may not notice symptoms right away. They may be masked and you may be unaware of the condition. But once the masking measures or the compensation are no longer working, then you might start to notice these symptoms and notice that, your body is just, it can't keep up. So things that may have seemed easy or simple, like climbing a flight of stairs or carrying groceries inside from your car, are going to become increasingly more difficult. One way that heart failure is diagnosed is with ejection fraction, and this is just a measurement of how much blood the left ventricle pumps out with each contraction. So a normal would be 50 to 70%, low is less than 40%, and high is greater than 75%. The third type of heart disease we're going to discuss is arrhythmias, and this is an abnormal heart rhythm. So with arrhythmias, they can affect how well your heart works, and your heart may not be able to pump enough blood in order to meet your body's needs. So common symptom is palpitations, which have been described as like a fluttering feeling of the heart. But other more serious symptoms may develop if the arrhythmia is untreated, including fatigue, dizziness, fainting or near fainting spells, shortness of breath, and also that chest pain or pressure. So bradycardia is something that, a term you may have heard, but this is when your heart is beating too slow, so less than 60 beats per minute. Tachycardia is going to be too fast at greater than 100 beats per minute. And then we have some examples. So atrial fibrillation, or AFib, is a type of arrhythmia that is caused by rapid, irregular beating of the heart's upper chambers. Okay. Ventricular fibrillation is a very serious condition that causes an abnormal heart rhythm that leads to death if it's not treated right away with an electrical shock to the heart called defibrillation. So arrhythmias can be very serious. Risk factors for arrhythmias include heart disease, including hypertension, age, chemical agents, and addictive substances like alcohol, cigarettes, and recreational drugs. And the final type of heart disease that we are going to cover is cardiomyopathy. So cardiomyopathy represents a collection of diverse conditions of the heart. This heart disease makes it harder for your heart to pump blood to the rest of your body. So this is going to happen when the heart muscle thickens, stiffens, thins out, or fills with substances the body produces that do not belong in the heart muscle. And that's going to lead to inadequate heart pumping or other problems. So causes here or contributing factors include family history of the disease, if you've had prior heart attacks, if you're experiencing uncontrolled high blood pressure, or certain viral or bacterial infections. Symptoms are going to be shortness of breath, fatigue, swelling in the ankles and legs, irregular heartbeat, and syncope. And syncope is the medical term for fainting. Okay. So now that we are more familiar with a few of the different types of heart disease, we're going to talk briefly about treatment. And the reason that I say briefly is because there are so many options for medications, so many surgical options and devices that can be used for treatment of different heart diseases. And honestly, we could spend an entire presentation just talking about treatment options. So I do want to kind of briefly touch on these things. But for the first type of heart disease that we talked about, coronary artery disease, treatment options include medication to help manage risk factors for coronary artery disease, such as if you have high blood pressure, making sure that you're managing that, or high cholesterol or diabetes, making sure that those things are managed. Surgical options include coronary angioplasty, and during this procedure, a balloon is inserted into the artery through a catheter and is inflated to help enlarge the passage through the artery. So that's a pretty interesting sounding procedure. Then we have the atherectomy, which is a rotating shaver that is used to go into the artery and remove that plaque or that fatty buildup to help widen the artery. And then coronary artery bypass is a more serious procedure in which an artery or a vein from another part of the body, such as the leg, is grafted onto the coronary artery and used to create a new route around a blocked section of the artery. So those are treatment options for coronary artery disease. For heart attack and stroke, both of these, as far as medications go, clot busters are common medications used for these conditions. And then for the heart attack, surgical procedure that could be used would be the coronary angioplasty or that coronary artery bypass. And for stroke, we have this carotid endarterectomy. And this is a surgery that removes plaque buildup from inside of the carotid artery in your neck. And this is to help restore normal blood flow to the brain and prevent stroke if you have already had symptoms or reduced blood flow. So moving to the other 3 types of heart disease that we discussed, again, medications, devices, and surgery are all going to be options. I'm not going to go too much into the devices and surgeries here because there are so many. As far as medications go, I will list a couple that seem to be common across the 3. So the first is an ACE inhibitor or an angiotensin converting enzyme. That's what ACE stands for. And these medications are used to widen or dilate the blood vessels and to help improve the amount of blood the heart pumps out. They can also help lower blood pressure. Beta blockers reduce the heart rate, helping to lower blood pressure as well. And diuretics cause the body to rid itself of excess fluids and sodiums. So all 3 of these medications that I talked about basically help to relieve the heart of some of this workload or to relieve some of the stress on the heart. I do want to say that some of the surgical options, or one of the surgical options for the heart failure and for the cardiomyopathy are heart transplant. And this would be a surgical procedure, obviously, in which a surgeon is going to replace the heart with a heart from an organ donor. So I can provide more information on treatment in the follow-up email. If that's something that you're interested in, just go ahead and let me know in the chat. Now I'm going to dive into risk factors for heart disease. So can anyone tell me 4, or maybe if you just know 1, of the non-modifiable risk factors for heart disease? So non-modifiable factors are going to be those things that we cannot change. So does anyone know any of the 4 non-modifiable risk factors? So I'm going to go ahead and share them, but they are age, sex, race, and family history. So these are things that can contribute to our risk of developing heart disease, but that we have really no control over. Modifiable risk factors for heart disease include unhealthy diet, inactive lifestyle, being overweight or obese, having high cholesterol or triglycerides, having low levels of good cholesterol, having high blood pressure, diabetes, or being a smoker. So each of these things are things that we can have some control over, or things that we can manage. So we're going to talk about how we can address these modifiable risk factors in order to best help us prevent the development of heart disease. So we're going to start with unhealthy diet. With your diet, there are foods that you want to avoid, foods that you want to limit, and foods that you want to eat. So when we're talking about foods that we want to avoid, we want to avoid foods that are high in saturated fats, trans fats, and sodium. So if you remember from our nutrition and shopping on a budget presentation, saturated fats and trans fats are considered the bad fats because they raise our bad cholesterol in the blood. And so we want to avoid these fats. We want to limit foods that are sugar-sweetened beverages or red meats, and we want to eat plenty of fruits and vegetables. Again, you want to get a nice variety, kind of have like a rainbow of fruits and vegetables. Fiber-rich whole grains, lean meats and fish, nuts, legumes and seeds, and lower-fat dairy products. When it comes to inactive lifestyle, we should be getting one of the following. So either 150 minutes a week of moderate intensity aerobic physical activity, or 75 minutes a week of vigorous intensity aerobic physical activity. So with moderate intensity, you're going to notice that your heart rate, your beat is increased. You're maybe breathing a little harder than usual, but you're still able to hold a conversation. Whereas with vigorous intensity, your body's gonna get really warm, you're gonna start sweating, you're feeling that your body is working harder, and it's gonna be a lot more difficult for you to be able to hold that conversation. So in addition to this, we also wanna make sure that we're getting muscle strengthening activities on 2 or more days of the week. Okay, so making sure that we're getting plenty of physical activity into our lifestyle. Okay. So here are a list of suggested activities that fall under both moderate intensity and vigorous intensity activities. And I want to hear from you. What are some of the things from both of these lists that you really enjoy doing? I know personally I enjoy dancing, not ballroom, kind of just randomly around my apartment. I also really enjoy running. That's something that I feel like I have to include into my exercise or physical activity routine. I also do some gardening. I pull weeds. So that's something that I like to do. Jumping rope and biking. But I saw gardening, I saw brisk walking, jumping rope, Zumba. Zumba is really awesome. Belly dancing is also really great. Alrighty. So the next modifiable factor that we're going to be talking about is high cholesterol. So with cholesterol, we have blood cholesterol and we also have dietary cholesterol. Blood cholesterol is a fat-like substance produced by our liver and is used in making hormones and digesting fatty foods. So your body makes all of the blood cholesterol that it's going to need. Dietary cholesterol, on the other hand, is going to be coming from our diet or what we eat and is found in animal products. And so we want to limit our dietary cholesterol. So when you talk about cholesterol with your provider, you may hear them say low density lipoproteins or high density lipoproteins, but they're usually abbreviated as LDL and HDL. So LDL are bad cholesterol, whereas HDL, or the high density, are good cholesterol. So below here I have some levels for where you want your these cholesterol levels to be at. LDL is considered bad cholesterol because it's going to be that cholesterol that helps to build up that plaque in the arteries, whereas the HDL is considered good cholesterol because it carries cholesterol from other parts of your body back to your liver to be removed from your body. Okay, so we want to have a pretty good amount of high density lipoproteins, and we want to keep our LDL on the lower side, less than 130. Triglycerides are the most common type of fat in the body. And although they're not a type of cholesterol, when you have your blood work drawn with your provider, they will often do a lipoprotein test. And whenever they talk about cholesterol, they'll talk about triglycerides as well. A high triglyceride level in combination with high that LDL and a low HDL is linked with fatty buildups in the artery walls and can increase the risk of heart attack and stroke, as we talked about earlier, because it's really that process of the atherosclerosis. So things that you can do to manage your cholesterol: eating a good diet, reducing those bad fats and cholesterol, making sure that we're managing our weight, because that can help to lower that bad cholesterol and raise your good cholesterol, making sure that we are physically active, that if we're smoking, that we quit smoking. Smoking actually lowers your good cholesterol, and that can contribute to higher levels of bad cholesterol, as we know, because if you don't have a good level of good cholesterol, it's not going to be able to do its job and move that bad cholesterol out. And then lastly, if you have to take medication for high cholesterol, making sure that you are compliant with your regimen, and that you're taking your medication as you should, because it's there to help you, obviously, and it might be necessary. Your provider is not going to be providing it for no reason. The next risk factor is high blood pressure. This is a major risk factor for heart disease and the greatest risk factor for stroke. So when you look at your blood pressure, you have two numbers. You have the systolic blood pressure, which is the top number, and this is the pressure that's created on your blood vessels when your heart beats. Whereas the diastolic blood pressure on the bottom is the pressure in the arteries when your heart is at rest between the beats. So I'm not sure if you're familiar with this new blood pressure guidelines or categories. In the past, you may have heard, oh, as long as it's less than 140/80, you're okay. But in 2017, the American Heart Association, the American College of Cardiology, and some other health organizations decided to lower these numbers for diagnosing hypertension after a study revealed that having a systolic of less than 120 reduced the risk of heart attack, heart failure, or stroke after a 3-year period. So there was a study done that found that having your systolic less than 120 really was more beneficial. And so the goal here with these new guidelines is to help people address hypertension and the problems, because there are many problems associated with hypertension much earlier. So if you have concerns now, I know when I talked about this with my mom and with my grandma, they weren't aware of these changes. So if you weren't aware of these changes and you have some concerns about your blood pressure, definitely speak to your physician about that. So some risk factors for hypertension, we're going to go over these, but these are also things that we can do to help with managing or our hypertension or preventing hypertension. So one is family history. We cannot change that. But if your parents or other close blood relatives have high blood pressure, it's likely that you're going to be at an increased risk. The age, the older you are, the more likely you are to develop high blood pressure. Your sex also plays a role. And it's interesting to note that along with sex, your age, at the age of 65 and older, women become more likely to get high blood pressure. Your race plays a role. Inactivity, so if you're not very physically active, we talked about that earlier. Having a poor diet, we talked about that as well. Obesity, so carrying too much weight puts extra strain on your heart and can cause serious heart health problems. Having high cholesterol, having diabetes, smoking, being under an immense amount of stress, and having high alcohol consumption. So the regular heavy use of alcohol can cause many heart problems and can cause your blood pressure to increase dramatically. So doing what we can with the things that we can. So not smoking, watching our weight, watching our alcohol consumption, managing our chronic conditions, eating a healthy diet. These can all help with preventing hypertension, which is a major, major risk factor for heart disease. Next, we have diabetes. So diabetes is a serious, widespread, and costly chronic disease, and it is actually the 6th leading cause of death for all Americans, not only women. But with type 1, the pancreas fails to produce enough insulin to regulate sugar metabolism, and type 2, the body fails to use insulin effectively. I'm not going to go into too much detail about diabetes because we actually have a presentation specifically over diabetes next week. So I hope that you will be able to sit in on that. So some risk factors for diabetes are pre-diabetes, being overweight, Your age, so if you're 45 years or older, you're at an increased risk. Family history, having a parent or a sibling, having a history of gestational diabetes, and this is diabetes during pregnancy, and then also race plays a role as well. The last factor that we're going to talk about is smoking. So smoking leads to permanent damage of the heart and blood vessels. The chemicals in cigarettes lead to atherosclerosis, that fatty plaque buildup that narrows your arteries and causes all those problems, and can also lead to blood clots. It's important to know that non-smokers are impacted as well. So secondhand smoke exposure increases your risk of having a heart attack or a stroke. So even if you aren't a smoker, but you're exposed to secondhand smoke frequently, it can have an impact. So the best thing to do to protect yourself and the ones that you love is just to never start smoking. There are also benefits to quitting. So within 20 minutes, your heart rate drops. Within 12 hours, the carbon monoxide level in your blood is going to drop to normal and allow for more oxygen to go to vital organs like your heart. And within 4 years, your risk of stroke is going to drop to that of lifetime non-smokers. So there are definitely some benefits to quitting. Whether you quit now or 20 minutes from now, right, you're going to notice some differences, some changes. Okay, so as I mentioned at the very beginning, this wasn't a deep dive. Heart health is a very, very, very interesting topic that we could spend a lot of time talking about. But I just want to go over a quick little review here. The importance of lifestyle changes, making the changes to your lifestyle that you can in order to help prevent heart disease and all of the complications that come along with it. If you do have any of the chronic conditions that we talked about that increase your risk for heart disease, making sure that you're managing those conditions through lifestyle changes and also through medications with the help of your provider and consulting them so that they can create a plan that's going to work best for you. If you have any questions or comments, please put them in the chat now, or feel free to email us at healtheducator@thewomensfund.org. Our staff will be able to get back to you if you have any questions through that email. I've also provided a link and the QR code for the survey. So if you can go ahead and take our survey, we would greatly appreciate that. I will copy the link here in just a second. These are our upcoming events. So next week, as I mentioned, we're going to be talking about diabetes. On the 19th, we'll be covering in case of an emergency, and on the 26th, we'll be covering immunizations. Again, here are our social media sites and our website. Feel free to follow us there for information about upcoming topics and events. For anyone who's interested in taking our survey, we are still going to be doing the survey raffle. So this starts a new, this presentation today starts a new opportunity for your name to be entered into our raffle competition. Whenever you take the survey, if you fill out your name and your email address, we will put your name down to be entered into a raffle drawing. So I think that this presentation through the immunizations presentation, that's 4 opportunities for you to get your name into a drawing for a $25 gift card. So